Welcome to this calm, peaceful moment. Take a deep breath in and gently release it. Today we're going to explore two different approaches to exfoliation, physical and chemical. Both can be effective, but they work in very different ways. Understanding these differences will help you choose the method that's right for your skin, your lifestyle, and your goals. There's no single correct answer, only what works best for you. Let's begin by understanding what exfoliation is at its core. Exfoliation is the process of removing dead skin cells from the surface of your skin. Your skin naturally sheds these cells continuously, but sometimes they accumulate, leading to dullness, rough texture, and clogged pores. Exfoliation helps accelerate this shedding process, revealing fresher, brighter skin underneath. The key difference between physical and chemical exfoliation is how they accomplish this goal. Physical exfoliation uses manual friction, scrubbing, rubbing, or abrading to physically remove dead cells. Think of it like using sandpaper to smooth wood. You're mechanically buffing away the rough outer layer. Chemical exfoliation uses acids or enzymes to dissolve the bonds holding dead cells to your skin. Think of it like using a solvent that loosens glue. The cells can then shed naturally without scrubbing. Let's explore physical exfoliation first. Physical exfoliants come in many forms: scrubs with granular particles, sugar, salt, jojoba beads, coffee grounds, cleansing brushes, konjac sponges, washcloths, exfoliating gloves, and microdermabrasion tools. The main advantage of physical exfoliation is immediate gratification. You can feel it working right away. Your skin feels noticeably smoother instantly. There's something satisfying about that immediate textural change. Physical exfoliation is also straightforward to use. You don't need to understand pH levels or wait times. You simply scrub and rinse. The simplicity appeals to many people. Some physical exfoliants provide gentle, effective exfoliation. Konjac sponges, for example, are incredibly gentle and perfect for sensitive skin. Fine, round jojoba beads provide smooth exfoliation without harsh abrasion. These gentler options can be excellent choices. However, physical exfoliation has significant drawbacks that you need to understand. First, it's easy to over-exfoliate with physical methods. That clean, smooth feeling can be addictive, leading people to scrub too hard or too frequently. Over-scrubbing damages your skin barrier, causes micro tears, and leads to irritation, redness, and sensitivity. Second, many physical exfoliants are too harsh. Scrubs with irregular, sharp particles, like walnut shells, apricot kernels, or salt crystals, can create micro tears in your skin. These tiny injuries compromise your barrier, allow bacteria to enter, and can lead to inflammation and infection. Third, physical exfoliation is uneven. You apply more pressure to some areas than others. You might over-scrub your cheeks while under-scrubbing your forehead. This inconsistency can lead to uneven results. Fourth, physical exfoliation isn't ideal for sensitive, acne-prone, or rosacea-prone skin. The friction and pressure can aggravate these conditions, causing more inflammation and problems. Fifth, physical exfoliation only works on the surface. It cannot penetrate pores, so if your main concern is clogged pores or blackheads, physical exfoliation won't be very effective. Now let's explore chemical exfoliation. Chemical exfoliants include AHAs, alpha hydroxy acids like glycolic and lactic acid, BHAs, beta hydroxy acids like salicylic acid, and enzymes like papain from papaya and bromelain from pineapple. The main advantage of chemical exfoliation is controlled, even results. When you apply a chemical exfoliant, it works uniformly across your entire face. Every area gets the same level of treatment. This consistency produces more, even predictable results. Chemical exfoliation is gentler on your skin barrier. There's no physical friction or scrubbing, so you're not creating micro tears or damaging your skin through mechanical force. The acids simply dissolve the bonds between cells, allowing them to shed naturally. Chemical exfoliants can penetrate pores. BHAs, especially being oil-soluble, can work inside your pores to clear clogs from within. This makes them far superior to physical exfoliation for treating blackheads, whiteheads, and acne. Chemical exfoliation offers additional benefits beyond just removing dead cells. AHAs increase hydration, stimulate collagen production, and fade hyperpigmentation. BHAs have anti-inflammatory properties. These bonus benefits add therapeutic value. Chemical exfoliation is customizable. You can choose different acids, concentrations, and frequencies to match your specific needs and tolerance level. You have much more control over the intensity and effects. However, chemical exfoliation also has challenges. First, there's a learning curve. You need to understand different acid types, proper concentrations, pH requirements, and how to safely incorporate them into your routine. This takes research and patience. Second, chemical exfoliants require sun protection. AHAs increase sun sensitivity by removing that protective layer of dead cells. You must be diligent about sunscreen when using chemical exfoliants. Third, initial purging can occur, especially with BHAs. Existing clogs may surface more quickly, causing temporary breakouts before your skin clears. This can be discouraging if you don't understand it's a normal part of the process. Fourth, chemical exfoliants take longer to show results. While physical exfoliation provides instant smoothness, chemical exfoliation's deeper, more significant improvements take weeks of consistent use to become visible. Fifth, chemical exfoliants can cause irritation if used incorrectly. Starting with too high a concentration, using them too frequently, or combining them with other strong actives can damage your skin barrier. So how do you choose between physical and chemical exfoliation? Consider your skin type first. If you have sensitive, reactive, or acne-prone skin, chemical exfoliation is generally better. The gentle, controlled nature works better for delicate skin. If you have resilient, normal skin, either method can work, though chemical is still typically gentler. Consider your skin concerns. For dullness and rough texture, either method works. For hyperpigmentation and fine lines, chemical exfoliation, specifically AHAs, is more effective. For clogged pores and acne, chemical exfoliation, specifically BHAs, is far superior. Consider your lifestyle. If you're bad about sunscreen, chemical exfoliation isn't ideal for you. It increases sun sensitivity too much. If you want something simple that works immediately, gentle physical exfoliation might suit you better. If you're willing to invest time in learning and being consistent, chemical exfoliation often produces better long-term results. Consider your preferences. Some people love the ritual and tactile satisfaction of scrubbing. Others prefer the hands-off simplicity of applying a toner or serum. Honor your preferences. The best routine is one you'll actually follow. Can you use both methods? Yes, but carefully. Some people use gentle physical exfoliation once a week and chemical exfoliation 2 to 3 times a week. However, this increases the risk of over-exfoliation. If you combine both, start conservatively and monitor your skin closely. If you choose physical exfoliation, follow these guidelines. Choose gentle exfoliants with smooth, round particles. Avoid harsh scrubs with irregular, sharp particles. Konjac sponges, jojoba beads, and fine rice powder are good options. Use light pressure. You should never scrub vigorously. Gentle circular motions with barely any pressure are sufficient. Limit frequency. Once or twice a week is plenty for most people. Daily physical exfoliation is almost always too much. Avoid scrubbing active acne, inflamed areas, or open skin. Never scrub if your skin is sunburned, windburned, or otherwise compromised. Follow with hydrating, soothing products to support your barrier after exfoliation. If you choose chemical exfoliation, follow these guidelines. Start with low concentrations and build up slowly. Patience is crucial. Use acids on clean, dry skin for best results. Always follow acids with moisturizer to support your barrier. Use sunscreen diligently every morning. Monitor your skin for signs of overexfoliation, redness, burning, excessive sensitivity, or shiny, tight skin. Don't combine multiple strong actives without understanding how they interact. The ultimate truth? For most people, properly used chemical exfoliation produces better, longer-lasting results with less risk of damage than physical exfoliation. However, very gentle physical exfoliation used occasionally, carefully, can be a pleasant addition to a routine. The worst approach is aggressive physical exfoliation, harsh scrubs used frequently with vigorous pressure. This damages skin far more than it helps. As we close, remember that exfoliation is just one tool in your skincare toolkit. It's not mandatory. If your skin is healthy, comfortable, and you're happy with it, you don't need to exfoliate at all. Your skin will shed cells naturally, but if you want brighter, smoother skin, proper exfoliation can help. Choose the method that fits your skin, your concerns, and your lifestyle. Use it wisely, gently, and consistently. Take a deep breath in and release it slowly. Trust yourself to make the right choice for your unique skin. May you find the exfoliation method that serves you best. May you use it with wisdom and
silicone oil, talc, isopropyl myristate, emollient, and certain botanical extracts that are irritating to acne-prone skin. Coconut oil, for example, is comedogenic for many acne-prone individuals despite being natural. Testing for acne cosmetica involves systematic elimination. If you suspect a product is causing acne, stop using it for 2 to 3 weeks and assess whether your acne improves. If it does, the product was likely responsible. Then reintroduce the product to confirm, though this re-triggers acne and can be frustrating. This elimination challenge approach definitively identifies culprit products. Non-comedogenic labeling helps identify acne-safe products, though labeling is not FDA regulated and varying definitions exist across brands. Non-comedogenic products are still not guaranteed safe for all individuals, but they're formulated to minimize pore clogging risk. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is particularly important to minimize infection risk. Professional dermatology care coordinated with immunology or HIV specialists optimizes acne management in immunocompromised individuals. This coordination ensures acne treatment doesn't interfere with immunosuppressive therapy. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity.
Đó chị mới bông. Nhìn sát rồi. Chịu khó xíu em ha, con sắp xong rồi. Tuần sau lại em nha. Muộn nhiều lắm em chịu khó chút rồi chơi. Rồi. Để vậy cho đỡ mỏi ha. Chào em nha.
Khó chịu rồi nói chuyện nha. Thả lỏng. Trời ơi, thả lỏng. Đúng rồi. nhiều. Rồi cố gắng thêm xíu đây nha. Đi thôi chị xíu nha. Cái cứng.
Welcome, and take a moment to breathe deeply. Let yourself relax into this peaceful space where we'll explore chemical exfoliation, specifically AHAs and BHAs. The word chemical can sound scary, and acid might make you nervous. But chemical exfoliation, when done correctly, is one of the gentlest and most effective ways to reveal brighter, smoother, healthier skin. There's nothing to fear here, only understanding to gain. Let's begin by understanding what exfoliation is and why your skin needs it. Your skin naturally sheds dead skin cells in a process called desquamation. Every minute of every day, you're losing thousands of dead cells from your skin's surface. This is normal, healthy, and necessary. These dead cells are replaced by fresh, new cells that travel up from deeper layers. When you're young, this process happens efficiently. Dead cells shed easily and your skin looks fresh and radiant. But as you age, or when various factors interfere, this natural shedding process slows down. Dead cells accumulate on your skin's surface, creating a dull, rough texture. Pores can become clogged. Your skin may look tired and lackluster. Exfoliation helps remove these accumulated dead cells, revealing the fresher, brighter skin underneath, and encouraging your skin to maintain that healthy cell turnover. There are two main types of exfoliation: physical and chemical. Physical exfoliation uses scrubbing particles or tools to manually remove dead cells. Chemical exfoliation uses acids or enzymes to dissolve the bonds between dead cells, allowing them to shed naturally. Today we're focusing on chemical exfoliation, specifically the two main categories, AHAs and BHAs. Let's start with AHAs, alpha hydroxy acids. AHAs are water-soluble acids derived from various natural sources. The most common AHAs in skincare are glycolic acid from sugarcane, lactic acid from milk, and mandelic acid from almonds. Each has slightly different properties, but all work on the surface of your skin. AHAs work by weakening the bonds that hold dead skin cells together on your skin's surface. Think of it like dissolving the glue that's keeping those cells stuck. Once the bonds weaken, the dead cells can shed away naturally, revealing the fresh skin underneath. This surface exfoliation brings multiple benefits. First, it improves skin texture. As dead cells are removed, your skin becomes smoother, softer, and more even. Rough patches diminish. Your skin feels refined. Second, A's brighten your complexion. That dull, lifeless look often comes from accumulated dead cells blocking light reflection. Remove those cells and your skin immediately looks more radiant, more luminous, more alive. Third, Oz can help fade dark spots and hyperpigmentation. By encouraging cell turnover, they help fade areas of excess pigmentation more quickly, leading to a more even tone over time. Fourth, AHAs can reduce the appearance of fine lines. While they won't eliminate deep wrinkles, regular use can soften fine lines by promoting cell renewal and improving skin texture. Fifth, AHAs enhance product absorption. When you remove that layer of dead cells, other products can penetrate more effectively. Your serums, moisturizers, and treatments work better on freshly exfoliated skin. Different AHAs have different strengths and characteristics. Glycolic acid has the smallest molecular size, allowing it to penetrate most deeply. This makes it very effective, but also potentially more irritating. Lactic acid is gentler while still being effective, and it also has humectant properties that help hydrate. Mandelic acid has the largest molecular size, making it the gentlest option, perfect for sensitive skin or beginners. Now let's talk about BHAs, beta-hydroxy acids. The main BHA used in skincare is salicylic acid. Unlike AHAs, which are water-soluble, salicylic acid is oil-soluble. This single difference makes it work very differently from AHAs and gives it unique benefits. Because salicylic acid is oil-soluble, it can penetrate into your pores, which are filled with sebum, oil. This makes it exceptionally effective for treating and preventing clogged pores, blackheads, and acne. It's like having a tiny cleaning crew that can work inside your pores, not just on the surface. Salicylic acid works by dissolving the debris that clogs pores, dead skin cells, excess sebum, and other buildup. It gently clears out pores from within, preventing and treating blackheads, whiteheads, and acne. Beyond its pore-clearing abilities, salicylic acid also has anti-inflammatory properties. This makes it doubly effective for acne-prone skin. It both treats the clogging that causes breakouts and reduces the inflammation that comes with them. Salicylic acid also exfoliates the surface of your skin, similar to AHAs, improving texture and brightness. However, its real superpower is that deep pore penetration. So how do you choose between AHAs and BHAs? If your main concerns are dullness, rough texture, fine lines, or hyperpigmentation, AHAs are your best choice. They work on the surface to brighten, smooth, and even your skin tone. If your main concerns are clogged pores, blackheads, whiteheads, or acne, BHAs are ideal. Their oil-soluble nature allows them to work inside pores where the problems originate. If you have combination concerns, perhaps some dullness plus some clogged pores, you might benefit from using both, though not necessarily at the same time. Now, let's talk about how to use AHAs and BHAs safely and effectively. Start slowly. If you're new to chemical exfoliation, your skin needs time to adjust. Begin with a low concentration, 5% glycolic acid or 0.5–1% salicylic acid, and use it just once or twice a week. Pay attention to how your skin responds. Some tingling is normal when you first apply acids, especially AHAs, but there should be no burning, no severe stinging, no lasting redness. If you experience these, the product is too strong or you're using it too frequently. Gradually increase frequency as your skin builds tolerance. You might eventually use acids 3 to 4 times per week, or even daily depending on your skin's resilience and needs. But this takes time, weeks or months of gradual introduction. Choose the right format for your needs. Chemical exfoliants come in various forms: toners, serums, peels, and pads. Daily toners have lower concentrations for regular use. Peels have higher concentrations for occasional intensive treatment. Start with lower concentration daily products before attempting peels. Apply acids to clean, dry skin. Water can dilute them and reduce their effectiveness. After cleansing, wait a few minutes for your skin to dry completely, then apply your acid product. Wait before applying other products. Acids work best at a specific pH level. Give them 10 to 15 minutes to work before applying other products. This wait time isn't mandatory, but it optimizes results. Always follow with moisturizer. Acids can be drying, so proper moisturization after use is essential. This replaces any moisture lost and supports your skin barrier. Use sunscreen diligently. AHAs increase sun sensitivity by removing that protective layer of dead cells. You should always use sunscreen, but it's especially crucial when using AHAs. Apply SPF 30 or higher every morning. BHAs also increase sun sensitivity, though to a lesser degree. Don't overexfoliate. More is not better with acids. Overexfoliation leads to irritation, redness, increased sensitivity, and a damaged barrier. If your skin feels raw, looks shiny, burns when you apply products, or becomes excessively sensitive, you're overexfoliating. Pull back immediately. Signs of proper exfoliation include smoother texture, brighter appearance, easier product absorption, and comfortable skin. Signs of overexfoliation include redness, burning, excessive sensitivity, shiny or tight skin, and increased breakouts. Be cautious about combining acids with other active ingredients. Acids plus retinol, acids plus vitamin C, acids plus more acids. These combinations can be extremely potent. If you use multiple actives, consider alternating them on different days, rather than layering them all at once. Who should avoid acids? If you have very sensitive skin, active eczema, rosacea flare-ups, or severely compromised skin barrier, acids may be too irritating. If you're on certain medications like Accutane, check with your dermatologist before using acids. Pregnancy and breastfeeding. Most AHAs are considered safe in moderate concentrations. Salicylic acid in leave-on products should be used cautiously and only in low concentrations, 2% or less. Always consult your healthcare provider. Let's discuss results and patience. Chemical exfoliation doesn't produce overnight miracles. You'll likely notice immediate smoothness after your first use, but significant improvements in texture, brightness, and clarity take time. Give it 4-6 weeks of consistent use before evaluating whether it's working for you. Some people experience initial purging when starting acids, especially BHAs. Purging means existing clogs surface more quickly, causing temporary breakouts. This is normal and usually resolves within a few weeks. If breakouts persist beyond 6 to 8 weeks, it's probably not purging but an actual negative reaction. Storage matters with acids. Keep them in cool, dark places. Some acids, particularly vitamin C combined with acids, can oxidize when exposed to light and air. As we close, remember that chemical exfoliation is a powerful tool for healthier, more radiant skin. Used wisely with patience and respect for your skin's needs, AHAs and BHAs can transform your complexion. But they require responsibility. These aren't products to use carelessly or aggressively. They're potent ingredients that demand understanding, patience, and proper sun protection. Take a deep breath in and release it slowly. Consider whether chemical exfoliation might benefit your skin, and if so, commit to using it thoughtfully and safely. May your skin be bright, smooth, and healthy. May you approach powerful ingredients with wisdom and care. May you find balance in your skincare routine. Thank you for this time together. Be well and be gentle with yourself. Welcome to this calm, peaceful space. Take a moment to breathe deeply. Today we're going to talk about retinol, perhaps the most powerful anti-aging ingredient in skincare. Retinol has a reputation. Some people swear by it. Others are intimidated. The truth lies in between. Retinol is incredibly effective when used correctly, but it requires respect and patience. Let's begin by understanding what retinol is. Retinol is a form of vitamin A. It's part of a family called retinoids. When you apply retinol to your skin, it converts into retinoic acid, the active form your skin cells can use. What makes retinol special is its ability to communicate with skin cells, telling them to behave like younger, healthier cells. Retinol increases cell turnover. Your skin sheds old cells and generates new ones, but this slows with age. Retinol speeds it up, revealing fresher, brighter skin. Second, retinol stimulates collagen production.